Hello, good afternoon. My name is Alexis Agee, and I'm a nursing student at Cedar Crest College, and I would like to discuss the effects of music therapy on cancer patients who have gone through a radical mastectomy. Breast cancer is a common disease among many female patients. At least 1 out of 8 females suffer from this disease, ages ranging from 35 to 50. The clinical trial of this article tries to find out whether or not music therapy is beneficial to cancer patients who have gone through a radical mastectomy. Anxiety is a #1 problem with breast cancer patients, so researchers have tried to come up with a way in which they can alleviate these factors of stress. Music therapy has been seen as a rehabilitation factor for many patients. Not many nursing studies have been done to find out whether or not music therapy is beneficial to patients who have cancer and who have gone through a radical mastectomy. Lydia Hall discusses a theoretical framework of the care, cure, and the core of the patient. She also goes on to discuss the illness, which can be defined as conscious and unconscious feelings that these cancer patients have. The dependent variable in this study is music. The dependent variable in this study is the anxiety levels of the patient, and the independent variable is music. The inclusion factors in this article were patients who had breast cancer who had gone through a radical mastectomy. Exclusion factors were patients who were sensitive to voice and did not want to hear music and were allergic to sounds. There were 2 hypotheses in this article. In the first hypothesis, the researchers stated that in the experimental group, anxiety would be reduced because of music therapy. And in the second, it discussed the treatment. The aim of this study was to decide whether or not music therapy was beneficial to these cancer patients that have gone through radical mastectomy. The sample size of this article states that it was 120 female patients from a hospital in China. The data collection was retrieved by the Chinese version of the State Anxiety Inventory. The experimental group was given the opportunity to choose music on an MP3 player and also receive routine nursing care. The control group was only allowed to receive routine nursing care in the intervention. There were 3 post-tests to this article. The first post-test was before the discharge hospital. The second was the admission hospital for chemotherapy, and the third was the admission hospital for chemotherapy. The Human Resource Ethical Committee provided written informed consent before the study was conducted with any of the participants. The EPI data retrieved the information, and the Anacaba model was used to analyze the information retrieved. The results of this study was concluded that music therapy was beneficial to these cancer patients that had gone through a radical mastectomy. The state of anxiety that these patients were categorized was from moderate to severe. Majority of the patients in this study were in the moderate category. 18% of the patients in this study were classified as severe anxiety. They concluded that music therapy was beneficial to these patients that had gone through radical mastectomy. Music therapy was then concluded to be therapeutic for these patients and could be done as a nursing intervention. The study was limited because in the control group, music was not provided and they were unable to examine further about the anxiety correlating with the music therapy. The conclusion of this article states that music therapy was beneficial to the patients that had gone through a radical mastectomy. These are my references, and thank you.